Health Information Management by Christian Hill. What is HIM? The Canadian Health Information Management Association, CHIMA, defines health information management, HIM, as the discipline that focuses on healthcare data and the management of healthcare information, regardless of the medium and format. In 1912, the American Medical Association and American Hospital Association realized that for the purposes of physician and surgeon accountability, improvements to documentation quality were required. Given the absence of localized, formal expertise, a group of interested individuals met at Massachusetts General Hospital to examine and study clinical records as they then existed. Together with a group of physicians, the Club of Record Clerks was formed to evaluate the standards of clinical records in the hospital, dispensaries, and other distinctly medical institutes. In 1913, the American College of Surgeons was founded with the stated goal of enhancing the quality of surgeries performed through better surgical training. As part of the efforts to standardize surgical training, high-quality health records were deemed essential. To further this goal, the College of Surgeons urged collaboration among leaders in patient record management. In October 1928, a meeting in Boston of American and Canadian leaders working with patient records led to the establishment of the Association of Record Librarians of North America. By the end of the charter year, 58 members were admitted from 25 states, the District of Columbia, and Canada. In 1942, the Canadian contingent created its own association and formed the Canadian Association of Medical Record Librarians. Though the federal letters patent were not received until 1949, CHIMA considers 1942 to be the anniversary date of the association. In the late 1960s, the Canadian Association of Medical Record Librarians, or CAMRL, Board of Directors made the decision to apply for college status and to grant a credential to identify the unique skill set of the health record professional. In 1972, a second charter was obtained to register the Canadian College of Health Record Administrators, CCHRA, with its own corporate letters patent. The college had a board of directors, bylaws, and formal policies and procedures. In 1976, the association and college amalgamated and thereafter functioned under one leadership. To be consistent with progressive and proactive international information-based healthcare, CAMRL changed its name in 1976 to the Canadian Health Record Association, or CHRA. The rapidly expanding need for and use of health information in the 21st century again resulted in changes to the association. A rebranding was initiated to reflect and communicate the enhanced role of the HIM profession in healthcare. In 2003, the CHRA became the Canadian Health Information Management Association, or CHIMA. The CHIMA Board of Directors identified a new strategic direction and implemented a marketing and communications framework to chart a new course for the association. The Board of the Council on Education set new priorities to advance the association, market the HIM professionals' unique skill set, and position members as key players in quality healthcare delivery in Canada. Current state of HIM professionals. CHIMA now represents all certified health information management professionals across Canada. Some certified HIM professional positions that can be obtained but are not limited to are decision support analysts, data quality managers, directors/managers, directors of quality improvement programs, chief information officers, utilization managers, chief privacy officers, and clinical classification and nomenclature specialists. The education and certificate options for HIM professionals in Canada are for diplomas, 2-year programs. There is colleges in BC, Alberta, Saskatchewan, Manitoba, several in Ontario and Quebec, and then one in Nova Scotia. For HIM degrees, there are 2 in Ontario. One is Conestoga College and the other is Ryerson University. There are also several different online courses that are accredited by CHIMA throughout Canada as well. So the role of HIM professionals in healthcare are to contribute to healthcare delivery as members of the healthcare team, manage health information services in health facilities, work with confidential health records, the format, content, quality, and use technologies to capture, manage, and analyze data, prepare, analyze, and present health information for use in healthcare delivery and financial and management planning, interact with medical staff, health providers, and management. They may specialize in areas such as research, management, quality improvement, risk analysis, clinical trials, and clinical financial resource integration. Manage skills, knowledge, and expertise through mandatory continuing professional education, or CPE. And this concludes the presentation on health information management.